Employers are tasked with solving our healthcare challenges. They bear the brunt of the rising costs of healthcare, and they're in a unique position in that not only do they pay for healthcare, but they have to be mindful of how their employees or their members experience that healthcare.
Employers truly do care, when they're looking at their benefits design and looking at what they're giving to their employees. And when an employee is on an infusion medication, it can be very burdensome and very expensive for both the employer and the employee. It means they're taking off work, using PTO to get their infusion treatments. It doesn't have to be that way.
Infusion spend is a huge cost driver and honestly is one of the largest unmanaged cost drivers. There are more and more drugs coming to market that are infused or injected, and so this problem that's really significant today is only going to get bigger.
With an organization like Local Infusion, employers are able to provide direction to those employees and guide them to care that is more cost-effective, yes, but it's also a better experience for them. They can use the Wi-Fi, they can relax in the recliners.
Our model provides the lowest cost care for infusion therapy that exists, but also the highest experience as well. A lot of patients do not even know about this because they've been doing things the way it's been done. Our goal is to connect our offering, our mission to as many people as possible. And so going directly to the source, which is employers, the people financially responsible for paying for these decisions, is a way to make sure that there's greater awareness and adoption of low-cost infusion therapy.
What we are offering to employers is really more convenience for their employees and also better outcomes. We're tracking adherence. We're making sure the patients are staying on therapy. We're detecting flares. That means less missed days of work, less hospitalizations, but also it's savings for both the employer and the employee.
The average self-funded employer would be able to realize around $40,000 to $50,000 in annual savings per patient by getting that patient into a local infusion center.
These drugs are like $120,000 annually to infuse, so you can have really substantial savings by moving them to a lower cost site of care, which also happens to be much better.
Not only would they save money though, but those patients would also see increased medication adherence, increased patient satisfaction, decreased sick time off because they'd be able to experience or receive therapy at a near home environment.
When your employees are looking forward to getting that treatment, it also makes them more productive. It makes them happier to work for an employer who values that for them.
It's really a win-win. It's an overall better experience and at a cheaper cost.